The effect sizes reported in this study were approximately 2.5 times greater than the effect sizes found in psychotherapy, and 4 times the positive effect observed with typical SSRIs. The important point is that a single dose of 25 milligrams of psilocybin provided significant relief from treatment-resistant depression in this particular patient population, but it is not the case that 100% of the people who took 25 milligrams of psilocybin experienced that relief. However, the majority of them did. Now, when you say majority in science, you really need to look to numbers. And the reason I'm not telling you, oh, it was 75% or 60% or 50% is because it depends on which time point people were analyzed. People were asked about their level of depression relief immediately after, 1 week after, 2 weeks after, 3 weeks after. And the degree of relief tended to change over time. In fact, it tended to diminish over time, but it was also stable, or remarkably stable, I should say, at least by my read, in the 25 milligram dose group. And that is summarized nicely in figure 2 of the paper, because they explored these people's levels of depression out to week 12, and they still saw a significant degree of depression relief 12 weeks after the single 25 milligram psilocybin dose session. So as I mentioned earlier, there are now about a dozen or so excellent studies, clinical trials, exploring the use of single or 2-session psilocybin treatment in that 25 to 30 milligram range, which seems to be the most effective dose for long-lasting relief from depression. Each one of those studies explored something different, as is important. Replication is also important, of course, in order to validate previous studies. But for instance, there have been comparisons of psilocybin versus SSRIs or other antidepressants. There have been comparisons of psilocybin plus psychoanalysis or cognitive behavioral therapy versus cognitive behavioral therapy alone or psychoanalysis alone. And so there's a lot of evaluation now of the clinical outcomes and the statistical outcomes of these subjective measures and even some objective measures of neurochemistry where that's possible in terms of trying to understand if and how psilocybin is effective for the treatment of depression. And the major takeaway is that indeed it does seem to be the case. And the numbers that I feel comfortable not throwing out there, but putting out to you reflect my conversation with Robin Carhart-Harris. Again, that will be released soon at hubermanlab.com, as well as takeaways from what I would say are the 6 broadest studies, meaning they had the widest range of age groups, the broadest demographic in terms of the subjects, their backgrounds, their levels of education, men, women, ethnicity, etc. And a lot of that can be summarized in the paper entitled Effects of Psilocybin-Assisted Therapy on Major Depressive Disorder. This was a particular randomized clinical trial, but in the discussion, I think they summarize it quite well, which is that if you look at the number of people who take this 25 milligram dose twice in sessions spaced about a week apart, what you will find is that anywhere from 60 to 75% of the people who have major depressive disorder who do these psilocybin sessions in the proper setting report a good experience with it, have minimal adverse events coming out of those sessions and in the weeks following. Those people experience substantial positive relief from major depression in ways that other treatments that they'd explored, including antidepressant drugs, cognitive behavioral therapy, and other types of therapy alone could not provide. Now, it's a general feature of these clinical trials focusing on psilocybin that people are asked to stop taking their antidepressants prior to participating in the trial. It's also a general feature of these trials that people are encouraged to not suddenly start their antidepressant treatment immediately afterwards, because of course that could confound the results of the psilocybin treatment. However, and this is a very important thing to note, all subjects were encouraged not to avoid taking those antidepressant medications if in fact their clinician felt that it was important for their immediate and long-term survival. So, no one should be reckless in thinking about what to add or delete from their drug protocol when dealing with depression, all right? The outcomes could be very severe in that case. Nonetheless, we can paraphrase from the discussion of the paper I just mentioned because it really highlights the incredible results that psilocybin applied in these particular therapeutic settings are providing. And here, again, I'm paraphrasing. The present trial showed that psilocybin administered in the context of supportive psychotherapy, consisting of approximately 11 hours of psychotherapy. So this is going to be 2 sessions of the psilocybin with proper therapeutic support. produced large, rapid, and sustained antidepressant effects. The effect sizes reported in the study were approximately 2.5 times greater than the effect sizes found in psychotherapy, and more than 4 times greater than the effect sizes found in psychopharmacologic depression treatment studies. In other words, 4 times the positive effect observed with typical SSRIs or other pharmacology of that sort.